As those on the front lines protecting your communities, you put your safety on the line every day. You learn quickly on this job that the dangerous part, the things that can hurt you the most, are usually hidden in the wall, the ceiling, the floor. But there's another hazard that we can't overlook, and that's infectious disease.
Our paramedics and pre-hospital care providers were actually the canaries in the mine.
When SARS first came about, it was identified as an atypical pneumonia.
When our acting captain ended up being hospitalized and treated, I was quarantined for having worked with him.
I went to a liver specialist who gave me a liver biopsy and found that I had hepatitis C.
I'm currently taking the PEC cocktail for post-exposure to HIV virus.
Every day you face stressful situations that may impact your career and family life forever. Each call for service presents a very real possibility that an unplanned exposure to an infectious disease can devastate even the most experienced veteran. Infectious disease has always been a hazard for firefighters, EMTs, and paramedics. And while the risks of infectious disease have increased, responders are much more aware of those risks and can use that knowledge to take action. This program will tell you why this potential problem may suddenly change your life forever, why you need to take precautions very seriously, and where you can go for information and for personalized help when you need it.
Whether you are new on the job as a firefighter or a seasoned veteran, when you come face to face with infectious disease, you may only get one chance to do the right thing. Pay close attention during the next few minutes as we discuss information that not only will protect you and your family from infectious disease, but also may save your life.
Think about it. Your job demands you to be a healthy person in good physical condition. You should have access to excellent medical care and get regular physical checkups.
First responders have what I would characterize as two different types of infections. One that they may acquire on the job, and those that they acquire just by virtue of being an adult on planet Earth. And they could include anything from rhinovirus, colds, influenza, but of more concern would be the acquisition of bloodborne pathogens, and I've certainly seen hepatitis C infections among first responders, hepatitis B, and hepatitis A.
First responders may contract infectious diseases at a higher rate than the general public. This should be a wake-up call to firefighters to increase awareness of infectious disease and the necessity for personal and employer responsibility. Now you can do nothing and be no worse off than the general public. Or you can get smart, get the training to learn about these diseases, be diligent in taking all the preventive steps, and above all, if you've been exposed, report it right away and get help.
To protect yourself, you need to know what's out there. So here's a quick review of some of the major diseases you may face on the job each day. You can be exposed in 4 distinct ways.
The first is through pathogens carried in the blood or body fluids. When you are in contact with blood or body fluids, there is always a risk of HIV or AIDS. As well, you should be thinking about the various strains of hepatitis. Remember, immunizing against hepatitis B also protects you from hepatitis D. Airborne pathogens include influenza, which can be a killer. Just one case can affect the responders in an entire firehouse. Measles, mumps, which can be especially vicious in adults. Rubella. Tuberculosis, which is still a major threat to our health. Meningitis, especially bacterial meningitis, which can be fatal if not diagnosed and treated in a timely fashion. Outbreaks of meningitis often are found in group housing, such as shelters or college dormitories. Chickenpox, and severe acute respiratory syndrome, or SARS, which poses a new threat to the public and to first responders.
Unfortunately, many people in the acute care setting do not have or did not have any understanding of the role that firefighters play in the application of pre-hospital care to sick patients. They didn't understand that those patients they see in the ER, we saw them first.
No one really knew what the outcome of the disease was going to be. I think people were definitely concerned about whether or not they'd been exposed and to what extent they'd been exposed and how likely they were to actually contract it.
Coming in contact with contaminated food or water can put you at risk of contracting hepatitis A. For example, think about the risk posed to water rescue teams while working in areas of disrupted sanitation, occurring after flooding or other major disasters. Or for any first responders working in areas of poor hygiene, or where they might ingest contaminated food or water. Infection may also be spread through person-to-person contact with those who are already infected. Pathogens can also be vector-borne. A vector is an animal such as a tick or mosquito that transmits the disease through bites. These include Lyme disease from ticks and West Nile virus or malaria from mosquitoes. Soil-borne pathogens include tetanus, which is preventable with a simple vaccination. Booster shots are required at least every 8 years.
Sometimes you have no idea what the scene may be like when you get there.
While it might seem like a simple rescue call, it may not be safe.
You didn't get into this job because you were afraid of risks. You're willing to accept the risks for positive outcomes. Make sure you take the proper steps when operating on the scene of an emergency. Ask yourself, what are the risks? And what needs to be done to minimize the risks? Here are a few examples that will really make you think.
I suffered a blood-borne exposure from broken glass at the medical call I was on. It's a very uncertain time for me. I don't know whether in 3 months, 6 months, or 12 months whether I'm going to test positive for HIV.
I was having extreme fatigue and really not capable of performing my job properly, and found that I had hepatitis C. I'm absolutely positive that there was blood-to-blood contact. If the proper protection had been provided and I wore it, I wouldn't be in this situation now.
As a first responder, you have a duty to care for the victims, but you also have the responsibility to do it safely. And that starts with taking adequate measures to protect yourself.
Even something as simple as a dumpster fire can be a dirty place. It can contain contaminated food, dirty diapers, or medical waste that could lead to the acquisition of hepatitis A, as well as other infectious diseases. A vehicle accident combines potentially infectious blood and body fluids with broken glass and jagged metal that can breach the skin. Your first line of defense is PPE, and that includes immunizations. Be sure you have all the appropriate vaccinations to prevent disease. Chickenpox, influenza, meningitis. You probably had childhood shots for measles, mumps, and rubella. Be sure they're up to date. Also, diphtheria and tetanus require periodic booster shots. And any first responder should definitely be vaccinated against hepatitis A and hepatitis B.
It is very easy to transmit hepatitis B. Therefore, the vaccine strategy for hepatitis B is critical. Hepatitis A vaccine now comes in a commercial product actually coupled with hepatitis B, and that vaccine is as well highly effective.
NFPA 1581 and 1582 clearly outline the immunizations that should be provided to you by your department. Baseline testing is also important, especially post-exposure, and should be provided by the department as well. Wellness and fitness, baseline testing, and immunizations are all essential items that will enhance your performance and could save your life. The world is different today. You never know what you'll face when you roll up on the scene. From new biological weapons, including diseases introduced by terrorists, to other chemicals, to nuclear threats. To be safe, you need to stay up to date with the latest information on the hazards you may face. A good source is the Centers for Disease Control and Prevention, which publishes reliable updates. And you'll find references to other reliable sources at the IAFF website. Personal protective equipment, from NFPA-approved turnout gear to gowns and gloves, provides a high level of protection against bloodborne and soil-borne pathogens. Look to NFPA 1999 for the standards on this.
8 to 10% of healthcare workers are allergic to latex. Remember, alternative personal protective equipment is available and should be provided for use by your department.
A properly fitted respirator offers good protection against airborne pathogens. For example, in the Toronto SARS infection case, first responders whose masks had been fit tested were not infected with SARS, even when working alongside a person who contracted the disease. National, state, and provincial regulations are there to protect you against conditions like SARS. Gloves are recommended PPE as defense against virtually all infectious diseases, and at times filter masks and eye protection can be beneficial. Whenever there is a concern about airborne pathogens, for safety, it is always better to mask your patient first, even before putting on your own mask. Good health habits, starting with washing your hands frequently and thoroughly, and properly disposing of gloves and other items, are also important protections against disease. Needle sticks often occur while cleaning up or decontaminating equipment. Sharps can be hidden in waste or contained in a biohazard container, so be careful.
One of those horrible moments that I can always remember in my career as a paramedic has been when I was stuck with a needle. At that moment, everything stood still for me. Where was that needle? Did I just get her blood? What kind of a patient does she look like? Is this the end of my career? I was in the category now of people who'd been stuck with a needle. And for good, better, or whatever, I had to realize I was in that category. There's nothing I could do about that, and I needed to fill out the paperwork and do what I needed to do because it protected me, it protected others around me, and it was the right thing to do.
If you're infected and don't know it, you're risking the futures of the people who are most important to you. So report every possible exposure and follow through with the available testing and treatment.
When it comes to infectious disease, if you learn everything you can and arm yourself with information, it can save your life.
So the last thing that ties into is...
When training sessions are offered, attend, take notes, and get all the handouts. And then keep updating your training on a regular basis to keep abreast of new threats, as well as improvements in protection and treatment. And check in regularly at the IAFF's website and click on Stay Safe to get the latest information about protecting yourself from infectious disease. The IAFF supports the standards for infectious disease protection that have been established by NFPA, OSHA, and the Canadian Standards Association. And you can find out a great deal of information about these on the website. Your jurisdiction may have established presumptive legislation for heart and lung, cancer, and infectious diseases. If your state or provincial government doesn't offer presumptive legislation, get involved.
First, use protective barriers and wash your hands. Secondly, if there are prevention strategies that are available to you, such as vaccines, please take them. Thirdly, when you have an event that could be an exposure, may be an exposure, or is an exposure, please report it and report it promptly. By keeping you safe, you are allowed to continue your mission to keep the population safe.
If you notice that somebody's not wearing their gear, let them know. It may not be a roof that you fall through, it may be a virus that you will never see.
I've seen the devastating effects these diseases have on IAFF members in Pennsylvania, Florida, California, Ontario, and departments large and small throughout Canada and the United States. The simple truth is every IAFF member and their family must be more aware of the risk that infectious disease presents to your health. That's why we created this video, to ensure that you receive the best possible information to protect yourself and your loved ones. Stay safe, and God bless.
For more information, go online to www.iaff.org or call 1-202-737-8484.